do the employees get their prescriptions filled? Is that through the mail, or do they go to any drugstore?
They can get it through the mail, or they can give it go to a drugstore. If they get a 3-month prescription at the drugstore rather than through the mail, it will cost them more, because doing mail order is a little cheaper. But if they decide to do it through the mail, it will cost them more.
Well, I've just always been curious, because I know when I had insurance on prescriptions, I had a copay of $10, but I could go over for 30 days, and I could go over to Walmart or any place else and get it for $4.
They can do
generic.
that. They can do that.
Well, I guess my question is, why should we pay for $8 generics? I mean, or how much of that is our cost? Is any of it our cost, or is the $8 pay for the entire amount of the generic?
If somebody is using one of the retail specialty programs right now, that $4 prescriptions, things like that, that doesn't go through the insurance at all.
Right.
So that's completely covered by that. If they're going through the insurance, which we have asked that Inovian, who is our pharmacy benefit manager, that they pre-program everybody's pharmacy cards, so that if somebody goes to fill a pharmacy or a prescription, they do a search and find the most economic way of filling that prescription. If I understand your question, you said, does the $8 cover part of our cost? It is a percentage of the cost, and it depends on what that drug is. But we certainly would pay on top of that the additional amounts.
Well, why would we want to if we can just send our employees? Well, if it's one of the generics, go to the drugstore and get it for $4. It saves them 50% of the cost, and it doesn't cost us anything.
We definitely encourage our employees to do that. Not all generics are covered by those programs. We've tried to publicize, check with the different pharmacy, or check with the different pharmacies ahead of time, so that when you go to the doctor, perhaps you can be requesting something that is on those lists, as opposed to finding out when you actually go get it filled that it's not one of them. But not all drugs are on that.
Do we require that our employees get the generic if it is available for any prescription?
We don't necessarily require that, but they are going to pay a much higher copay if they elect to get a brand name. So, for example, if you are on a drug and a generic becomes available, then you no longer cover that at that lower rate, and somebody would be paying $40 copay as opposed to $8.
So if they're mailing them in, like it's a monthly prescription, do you require that it be filled as a generic?
It is filled as a generic unless they specifically request not a generic, and if they do request that, they pay more.
They're going to pay 2 times whatever the appropriate tier copay is. So if it's a formulary or non-formulary drug and the copay is $40, the mail order cost of that for a 3-month supply would be $80.
Because I know in my insurance plan that if they send in a prescription, and let's say as an example, there was no generic for that prescription, they would actually get on the phone to the doctor and say, is it all right if we give them this one because it's in the same family and it will do the same thing, in order to make it a generic and save money. These are all ways in which most companies are saving money on, especially on the drugs, which is the big problem, one of the big problems on health insurance.
It works the same way.
One of the other features of our PBM, or Pharmacy Benefit Manager, is we also offer a program called the Wise Choice Program, which is consultative services for employees to look at what other drugs in that class might be suitable, so that they can go and talk with the doctor for cost-saving measures. And that benefits both the employer and also the employees, because when they're saving money, it's natural also our percentage is less too. So,
but your drug company, or the one that manages the prescriptions, that prescription company doesn't automatically do that, call the doctor and get the generic of it?
Well, they wouldn't change a drug necessarily without that consultation. But if there is a drug that someone's requesting and a generic is available in that class, they would go ahead and get the generic unless it's written, dispense as written. And there's sometimes good reasons why people cannot use generics. Maybe they're allergic to a binder or
Or
something
they don't
like
work
that.
the same. It may, the overall drug may be a generic, but the real one has a little something extra sometimes that the other one doesn't, and so that's the reason why you don't know how to
And
get
that
it.
does happen
Yeah.
sometimes.
Well, and that's why they always call the doctor and ask their permission to change to the one in the same family. But it really cuts the cost if that's, I mean, if that's how they manage it and that's the way they should. That's, I know in my corporation, Worldwide Corporation, that's what they did. So I just would like to see us get on board with as much cost saving as we can, because we all know health expense is one of the greatest costs.
And we do outreach to our employees via the PBM for drugs that have recently gone off patents. They've developed a generic equivalent. There's other options. We're having people actually receive letters and saying, hey, there's some other options available at a more cost-effective rate. And we're really trying to build that consumerism among our employees so that, again, that they're saving money and it is also benefiting the city. So point well taken.
I think it's important, though, that we're on the cusp right now in the United States with healthcare reform. We're on the cusp, but we have to realize that there needs to be a balance between drug companies telling patients what they need to do versus doctors wanting, trying to decide the best course of action for their patients as well. And so I think that's just a conflict that's here, and I do know, it's a national problem.
Well, I mean, doctors tend to write. I mean, because most of them own stock in all the drug companies, so they tend to write the non-generic, latest drug that's out there and the most expensive, and so you do have to have people who are oversight of that, and I know my doctor's always been cooperative with that, although I've now gotten in the habit to always say, hey, I want a $4 generic because there's something out there that'll do it, so I've learned to do that. But I mean, you can't leave it to the doctor, because many times because they just had somebody in giving them samples of it. Hey, this is the best one out there. Hey, this is the newest, and they just write it and don't think anything of it. So that's why usually you have whoever is, doing your prescription drugs file, or give them. I mean, other places they do that. They just make sure that make every effort to go with the generic.
Sounds like they're doing that. We've got a professional company that is in the healthcare business.
Well, it sounds like it's more voluntary than it is.
Well, and also just